everybody. Hopefully technology is working today. I am Dr. Jordan Leasure. I'm the owner and physician of North Shore Proactive Health, a state-of-the-art wellness clinic in the northern Chicago suburbs. I am a functional medicine chiropractor, and you are in my stress boot camp, and we are talking today about meal planning. So, I had a few technical difficulties over the weekend, so this video is just going to knock it out of the park. It's going to be so spectacular, but I need you to give me some feedback so I can make sure things are working. So please give me a thumbs up, give me a like, give me a question, holler at me, let me know if you are watching live, let me know if you're watching the replay when you're watching, and if you're finding this beneficial, because I did a 30-minute video Saturday night with no sound. So let's make sure that this one is actually coming through, can we? And we are going to hop in today. We're talking meal planning, so we are going to discuss what meal planning is, types of meal plans, even maybe different diets that people are on. So please let me know if you have questions. If you have a question after the fact, feel free to send me a private message. If there's something that you would like to discuss anonymously with the group, you can always send me a message and I will post it out to everyone. Again, this group is for you. This is for me to share information, but it's for you to learn, commiserate with others, share your hints and tips as well. So if there's things that you feel are missing, holes in information, gaps, fill them in. That's what this is about. We're all going to learn together. So, a little bit about meal planning. What is meal planning? Why should you meal plan? So I find myself that I have a few different jobs. Being a mom is one of them. And if I'm leaving my office, seeing patients, and I literally live 1 minute from my house, and if I get home at 6:30, the last thing that I want to do is start thinking about making dinner. I also prefer to eat in my office. I don't like going out and either spending additional money or not knowing, what I'm going to get at a restaurant, so I like to have my meals planned for lunch, and for breakfast, same thing. With a toddler, you never know what your mornings are going to look like, so if we can plan ahead, I make sure that everyone is eating healthy. So that's for me why I like to plan, because even with a house full of food, and I have more kitchen gadgets than I would like to name, but if it is 6:30, I'm going to say, there's nothing in the house, and either have a protein shake for dinner or, unfortunately, order out. And when we have a toddler that should be in bed at 7:30, starting to eat dinner at 7 o'clock or 7:15 doesn't work. So that's another reason that I need to meal plan. Now, the very basic outline for you, if you're starting to meal plan, if you're not sure what to do, is to eat a variety of colors of fruits and vegetables. Easiest thing that you can do for your family. One of the handouts I'm going to put up today is going to be the phytonutrient spectrum, and you can print that out. You can put it on the fridge, make it like a game where you're trying to eat red, orange, yellow, green, blue, purple, and yes, there are fruits and vegetables that fall into each of those categories. Even white is going to be beneficial when it comes to fruits and vegetables. Hey Lydia, let me know you can hear me. And you can also take a photo of that and then bring it to the store and maybe pick out, what you haven't been eating. Pick out a fruit and vegetable. Now is the time. Unfortunately, the one thing that a lot of us do have is time. It may be unorganized, but we do seem to have a little bit more time. So picture, pull something out that you haven't cooked before, find a recipe. Google is fantastic for this. So find something new and exciting, cook it, and you may find something that you like, and you may learn new ways to cook things that you've been eating, the same old way for years. So that's a great time to experiment now. But I'm going to put up that phytonutrient spectrum and see what you guys think. I'm going to run through a handful of plans that I use in my office with my functional medicine clients. Now, these are all going to be very specific. They all serve a different purpose, and they may not be appropriate for you, but what I would suggest is knowing the difference between a diet and a meal plan. So a diet by nature is meant to be short term. And the reason that the old adage is diets don't work is because, again, they're meant to be short term. They serve a purpose. If you are on the ketogenic diet, for instance, that is not meant to be a long-term program. And especially for keto, please make sure that you are following a physician's guidance and you are not simply trying to eat high fat and no carbs and not know exactly what's going on in your body chemistry, because there's a lot of nutrition that gets left out on the keto plan, and that's part of the reason it's meant to be short term. But enough about keto. If you do a sugar restrictive diet, for instance, like a plan to get rid of yeast, I have a lot of patients on a candida diet. Same thing. It's awesome. It serves a very specific purpose, and it's meant to be short term. So if you see that term diet, meant to be short term, if you see food plan like that, that's something that you can use for the long term. If you like it, if it works for you, stick with that. It is a way of eating. Now, what I use quite routinely for my clients is something called the core food plan. What I will vary depending on client in order to make it specific is the number of calories that my client is consuming. And if I have someone that is a vegetarian, I have specific programs I provide to them, obviously, that are meat-free. I've done a vegan core food plan before, but that is going to be your typical plan, similar to like a Mediterranean diet. I like all of my patients to eat as clean as possible, no matter what their current health status is. So in my office, that means minimal or no gluten, minimal or no dairy, and we try to minimize the sugar, and yes, that does mean alcohol, because all of those are very inflammatory. So if you have concerns right now, if you're one of the individuals that is strictly staying at home, if you are trying to keep your family as safe as possible, please remember that that includes decreasing inflammation. You are protecting yourself by being proactive in your choices, and by bringing that inflammation down, you're going to be boosting your immune system and your immune system's ability to react to any invader, not just the acute stressor that's out there right now. The second most common plan that I use is going to be a cardio-metabolic food plan. And this one is fantastic for individuals that are experiencing variations in blood sugar. Now, that might be hypoglycemic, that might be pre-diabetic, it might be type 2 diabetic. And, I don't really consider anyone... I hear a lot in my practice, unfortunately, allopathic physicians telling their patients that they are pre-diabetic. And I can tell you that most people changes to their health until they absolutely have to. And for some people, that's hearing literally from their doctor that they now have type 2 diabetes. Hearing that they are pre-type 2, they're like, I have time. What does that mean? You have time to eat crummy for another few months until you tip the scales and now things are bad enough that you're diagnosed type 2 diabetic? No, I want you changing those habits ASAP. And, this cardiometabolic plan is fantastic for that. It is a much tighter plan than our core food plan. It is a, let's say, strict Mediterranean diet. We like to see them eating additional servings of omegas, more fish, wild-caught fish ideally. Small wild-caught fish is the best. And this is another one that I utilize, and I can also modify the caloric intake so that if it is in a patient's plan that they're hoping to lose some weight, we can play with how many calories they're taking in, take a look at what food servings should be for those individuals. It's very easy. A detox food plan. We're going to talk detoxing this week. A detox food plan is terrific. If I have a client that is, let's say, in a high-risk profession, someone that does construction, someone that is a hairdresser and spends, all day, every day, is literally immersed in toxins, we want to do what we can to help their body clear those. And unfortunately, if someone has different metabolic diseases going on and they are taking multiple multiple prescriptions, those prescriptions may be helping symptomatology, but they're also gumming up the works and they're toxic to us. So we want to try and get any extraneous toxins out. So a detox food plan is terrific. And how do you do that with a food plan, you may ask? But we increase foods that are going to help with those detoxification processes. They're high in certain vitamins and minerals that are going to help phase 1 and phase 2 of detoxification. They also help make sure that you are going to the bathroom, because bowel movements are one of the ways that we get rid of those toxins. So we don't want to free everything up and then be constipated and not be able to get rid of the toxins. So keeping water high is very important in this program. Again, having 1 to 2 bowel movements a day is super important. So lots of options there. I also utilize something called a mito food plan, which stands for mitochondria. And the mito plan helps. So if you remember back to junior high science, your mitochondria is where all the energy comes from. It's the powerhouse of the cell. And we want to make sure that there's enough energy for all of your daily processes. There's enough energy to detoxify. There's enough energy for you, all of your organs and systems to function. Energy is very important. Your brain and your heart are 2 organs that never get to rest. We want to make sure they're functioning as well as they can. And that mito food plan does just that. It creates energy, and it helps to minimize the expenditure in areas where it's not needed. A renew food plan is something that I use not as frequently, but this is another good one. It's going to provide all of the necessary vitamins and minerals, and I'm losing my other plans here. I apologize. But Renew is a great way if you're coming off of a different diet and you're reintroducing foods. Renew is a nice program to use. So speaking of diets, one that I use quite regularly is an elimination diet. And this is another one that I would suggest that you undergo under the guidance of a physician, because there's a right way to test for food sensitivities and there's a wrong way. If you are looking for an immediate answer, if you have a child with ADHD, bedwetting, GI issues, sinus issues, chronic ear infections, a lot of that can be attributed to food sensitivities. And a sensitivity is very different than an allergy, in that the reaction is much more gradual. It's not like you have an allergy, you eat shellfish and your throat closes up. This could be anything from a mood disorder. Like I said, bedwetting can be attributed to food allergies. The chronic ear infections, where your body just can't recover and your immune system isn't working as well as it can be. Zits, poor skin quality, gas, bloating, all of those things can be attributed to a food sensitivity. So making sure that you are following a specific plan to eliminate, and then a specific plan in order to reintroduce, is going to be very important in tracking your symptomatology when it comes to food sensitivities, because they can be kind of tricky. I do a lot of blood work for patients that think that they may have a food sensitivity, because that gives you a cut and dry answer on whether or not you do. And that sensitivity may be to something random. I don't even know. Obviously dyes we try to stay away from, especially in children, because everyone is sensitive. You shouldn't be using dyes in your food. But everything from, let's say, a pork sensitivity to, dairy is very common in our office, gluten, and the types of oats and wheat and all of those can be happening as well. Rye I've seen. But having a nice cut and dry answer on if you have a food sensitivity or not will help with your meal planning and for the meal planning of your family. And food sensitivities aren't permanent. I've seen patients where they're able to heal their gut, and then they can reintroduce some of those foods that were previously causing some sensitivities. Now, some very specific food plans that we utilize, I kind of touched on earlier, an anti-candida food plan. If I run a blood workup on a patient and they find that they have a chronic yeast overgrowth, and that is not just like vaginally where we think of having a yeast infection, but you can have a chronic systemic yeast buildup, and your body has to fight that 24/7. So that can contribute to autoimmune diseases. I've seen that in Crohn's. I've seen that in rheumatoid. And once we're able to get rid of that underlying problem and get that yeast out of there, that symptomatology for rheumatoid actually goes away. So that is a terrific place to look. If you're diagnosed with a chronic disease and you really want to get to the root cause of it, functional medicine is going to be your answer. But that anti-candida food plan is very strict. It's very tight. It limits and eliminates all sugars, including fruit. So you want to be really careful, obviously, in what you're eating, how long you're doing a program of that type, because you may be deficient in vitamins from doing something like that, even though it's effective in eliminating the yeast. Doing a low FODMAP plan. I've seen a lot of patients follow something similar to this. They're not quite sure. Again, they get their program from Dr. Google. But again, please make sure you're dealing with a physician when you're following any of these really specific plans, following a specific carbohydrate diet similar to a FODMAP plan. What else can we discuss? Those are the majority of the things that I utilize. I like using a diet, nutrition, and lifestyle journal when I'm doing this with patients so that they can track how they're feeling, what they're eating, and what's going on in addition to diet. Because as we talked before, what's happening between the ears is very important, and what's happening, waist down, if you're walking, if you're doing yoga. Our activity is very key in what's going on with all of the functioning of our systems. Our brain is meant to be housed in this system that's moving. So it's important to be exercising. It's important to be doing this. Exercise is not just for weight loss. It's to make sure that you as a system are functioning as well as you can. So I like patients to keep a journal. And then, of course, sometimes you have to keep a journal if you're doing something such as a food elimination program where you're reintroducing something. You want to be able to track symptoms and see how you're feeling with different types of food. So that's very important. Now, specific plans, if you're not following a specific plan and you're just looking to get a little more organized, I did upload already a free week plan. It's our Stress Buster, if I can get to it. It's our Stress Buster meal plan. It's a week plan that I put together. It is breakfast, lunch, dinner, and 2 snacks. And it provides you a shopping list of what you'll need to purchase in order to make the recipes. It provides you all of the recipes that you'll need for the week. And it provides you the organizer, the plan of what to eat when, what to cook, what's going to be left over, things like that. And I'm a very big fan of meal planning, but cooking ahead. So I do not have a problem with leftovers. My husband doesn't like leftovers. But if I can cook once and eat something for dinner and then for lunch, it makes my life a million times easier. And I also like to have the ability of putting something in the crock pot either the night before, maybe I'm going to make a baked oatmeal, or even, the afternoon, and then have something ready for dinner that evening. So I'm a big fan of the crock pot and cooking in bulk. And depending on what your family's preferences are, if you're able to do that, it will save you time. And when you are prepping in that manner, you want to have some Tupperware available or whatever your way of keeping your meals ready for the next day is. But I like to set everything out and plate, let's say, the meals for dinner, and then at that same time package up what's going in the fridge for dinner or lunch the next day. That helps keep me organized as far as serving size, and maybe I'm getting a little bit more out of the meals than I anticipated, or if it looks like it's not going to quite be enough, then I know that ahead of time, not when I'm going, not when it's 8 o'clock at night and I need to start planning lunch or dinner for the next day. So that's where I find meal planning being very easy and very effective for us. Now, if there's any questions with any of this, as always, please let me know and we can answer after the fact. If there's a plan that you're interested in, or you feel like this could be beneficial for you, we have been doing discounted one point visit. So what that means that if someone has a concern that they're looking to address right now, it's a 20-minute visit, and it is discounted from our typical fees. So if you want to kind of dip your toe in functional medicine and see how it is that I approach something, that may be an awesome opportunity for you. There's a handful of free resources on the Salutogenic Life website. So in addition to the Stress Buster meal plan, there is also 2 quick and easy snack guides, and they're both different. So we have a quick guide to sugar-free snacks for busy moms and gentlemen. You are allowed to download this one as well. There's also the ultimate sugar-free snack guide for Wonder Woman. And the reason I made them a little bit different is our Wonder Woman snack guide is more geared toward adults. So women like myself, you're running around, you want to be able to pull something out of your purse and snack, or out of your computer bag, which mine is literally a piece of luggage. I carry so much with me. The other one, the guide for busy moms, is things that kids will eat. So, they are all of these recipes are Parker approved. So I would love your feedback if you download them and make anything from these plans. Take pictures, share them, please, and let me have your feedback on what your family thinks. There's also a few other programs that we've put together. There's a 21-day sugar detox. There is a vegetarian plan that I put together for patients on there. There's a leaky gut diet, and we do personalized plans. So if you're looking at this and none of them really resonate with you and you want me to put together a personalized plan, that is an option. I call it a 3 and 3. So you get to give me 3 foods that your family absolutely will not eat, and then 3 foods that you would like included. And you get a 5-day plan of 3 meals and 2 snacks, including your stuff, not including what you don't want. And you get to give that kind of a test drive and see what you think. So if any of that resonates, please let me know. There's a lot of stress going on right now, and even though we appear to have more time, for me, for instance, I have no childcare. So Will's watching Parker when I'm seeing patients. When he's trying to work from home, I'm trying to keep Parker occupied. So my time to work on my business is minimal, in addition to obviously filling out all these resources for small business owners that allegedly are out there. We'll see if any of it sees the light of day. So it's a crazy time for everybody, is my point. Now, should have time to eat. You should have time to prepare meals. Please don't, utilize all the, I have friends in hospitality, so they know I'm saying this. Don't eat out every meal. Plan ahead. Make sure your family is eating healthy, because the food choices that you make right now will impact your immune system in the short and long term. And I want you to be as healthy as possible. So take a look at the plans that are available. Let me know if there's questions, what you should be eating, what you should not be eating. We've done other videos on food. There's lots of options. So please share this. I appreciate you taking the time. We're all going to get through this together. We're going to manage our stress, being proactive in our choices about what we're eating, how we're moving, and how we're thinking. So as always, love you. Mwah. Have a wonderful week and stay tuned.